Hello everyone and welcome to today's class. We'll be looking at the introduction to the OSCE exams basically. Before we start, my name is Emmanuel and I'm going to be your anchor for this training session. So I suppose you're already preparing for your OSCE exams in the coming weeks or in the coming months. So it's going to be a long journey, but we'll take it step by step so that you understand every step of the way. So we'll start by talking about the OSCE. The pattern of the OSCE here in the UK is a bit different from what is obtainable in your home country. So firstly, you will be assigned to one assessor, and this assessor will assess you through all the 10 stations. And so everything that will be done is just between you and this assessor, and there will be a cubicle with you, just you and the patient, you and the assessor, and sometimes there will be a patient, someone that will be acting as a patient, if you understand what I mean. So after each station, you go out, the assessor arrange the place, then you come back and so forth till you finish all the 10 stations. So that is basically the station and how the arrangement looks like. So I'll be discussing the tips, some tips that you need to know to get maximal result out of your preparation for this exam. And then the first thing I will say is the first tip is understand the format of the exams. So the exam has 10 stations, as I mentioned earlier on, and these 10 stations are classified. They are classified into 4 different sections. All right. So the first session is known as the API session, and the API sessions we have the assessment, planning, implementation, and evaluation. So these stations usually come together, but it does not mean that you're going to do them first. You could actually start with the skill stations, or you could start with API. So the arrangement doesn't matter, but just know that when you're starting with API, you will have to finish the whole API stations. I'll talk more about the API stations in a subsequent or in a separate video. So now the second aspect of the exam is the skill stations. Now in the skill stations, you have about 20 skills. Initially there were more than this, but recently there were some changes in the NMC exam, so now we have about 20 skills. Now in the adult exams, adult OSCE, you are expected to do 4 out of the 20, so you are supposed to know all the 20 stations under the skill stations. So as I said earlier on, you are going to do 4 out of the 20. So if you add 4 plus the API 4, it makes it 8 stations altogether. So that is the second category of the OSCE 10 stations. Now the next one is the professional value. Okay, now the professional value stations, there are roughly about 15 thereabout, 15 of them, and you are going to answer just one, okay, out of this 15. So please just take note that each of these are different sections of the OSCE. As we go along, we'll discuss each of them. So but just know that there are different topics, about 15 of them in the professional value, and you'll be asked to answer one of them. So that makes it 9 stations altogether. The last one now is the evidence base. The evidence base is like research articles that will be asked on the exam day, and you're meant to just summarize it based on some criteria that are already on your marking criteria. So there are also about 14 or 15 thereabout, and you'll be asked just one, so that makes it 10. So you should understand this format. It's very, very, very important. And as I said earlier on, we are going to discuss each of them in separate discussion. So what is the second tip that you should know? The second tip is practice your OSCE skills regularly. Now, please just know that this is an exam. Okay, so you may be very, very skillful in your word or in the word setting, or you know how to do these things very well, but because now you are in an exam situation, somebody is looking at you, there are cameras all around, and then you are in a new environment, there is bound to be, there's this tension that is meant to be there. So that is why you need to practice regular. That practice regularly gives you confidence and boldness. So practice all the skills. Don't assume that I can do it. It's not just I can do it very well. No, do not assume. Practice regularly. Then number 3 skills number 3 tips that I want you to know is master the API stations very, very well. And under this, I'll talk about things you should master under assessment, planning, implementation, and evaluation in just brief terms. So under the assessment, master your documentation. Very, very important. Master your documentation, your news 2 chart. Know how to chart it correctly, all the details, ensure that they are all complete, because if one aspect of this is not filled, it's automatic fail, and we don't want that to happen. Okay, so know that you're going to be doing the A to E assessment. If you check your marking criteria, there's what we call the A to E assessment. Sometimes some people fail because they have incomplete A to E assessment. So ensure that your A to E assessment is complete. Then do your allergy check, very, very important, and then pain score. Then under planning, ensure that you prioritize your nursing problems appropriately using the SMART technique. We'll call it specific, measurable, attainable, achievable, then realistic and time bound. So under planning, we'll talk a little about that, but ensure that your problems, the problem of your patient, is prioritized according to urgency or according to importance. So then do not forget, in planning again, you have to do your documentations correctly, including your signatures and your dates. Then implementation, things that you should take note under implementation, focus on medication administration and then patient care, and check all the 5 rights, and then drug administration. Then for last evaluation, reflect on interventions and then patient outcome. Be clear and concise. Ensure to mention all the important relevant information about your patient, like allergy, like things that you need to hand over to the patient. But please take note that this is just an overview. All of these are coming bit by bit as we progress. Then number 4 skills, number 4 tips for your OSCE success, for your OSCE, that you need to know is communicate clearly and compassionately. I cannot emphasize this. You have to use therapeutic communication skills. Avoid memorizing what to say and then coming up with this one pattern of saying things. Learn to flow with the patient, or flow with your patient as you go along with your communication. Don't learn how to say one word and you keep saying it like you're memorizing, you're cramming something. So address your patient respectfully and then explain procedures clearly. Very, very important. Then number 5 skills: know your guidelines, know your the codes, and then your marking criteria. Practice them adequately. Second to the last is now time management. Now, if you do everything correctly and then you fail to meet up with your time, obviously you're going to come back for that station. So on that day, you have your watch, and your assessor will be giving you a signal for time. So please be time conscious, particularly stations that demand a lot of activities. So please be time conscious. Do not spend too much time on one task. Try to be very, very precise with your timing. Then the last thing I would say under skills that you need to know to maximize your OSCE is stay calm under pressure. I know this part is very, very, very controversial. Why do I mean so? This is personal. Some persons will become under pressure while others may not. But I tell you, one secret to overcoming this aspect of the exam is practice. When you practice enough, you are confident. Practice with others, and then also seek for help, okay, when you need one. But above all, what I would advise is on the day of the exam, if you know that you are really, really tensed, and when the assessor is asking you, do you need any help, just verbalize that I'm a bit tensed. And they are professionals, they are very, very professional, and they are also there to help you pass your exam. So they'll say things that will calm you down. Do not, please, this is a warning from me, do not start your exams when you are tensed. You are going to make a lot of mistakes, and above all, your comprehension will be affected. You'll be missing words, you'll be mixing things up. So please do not start your exams, particularly if you are all shaky and anxious and nervous. Try to calm. So what are the steps? Taking deep breaths. Know that you've prepared for this exam, you've got it, you've spent all the money you need to spend for the exam, and then today is the D-Day, so just know that you can make it. Okay, so in my next video, I'll be talking about common pitfalls that you should avoid to be able to pass your exams without stress.